Most women describe their first time in one word: underwhelming. And honestly, that's a good thing. We've been conditioned to fear the big moment, but the secret to a safe, positive experience isn't about the act itself. It's about what happens in your brain before it even starts. Let's talk about the science of your first time. No one really talks about it honestly. You hear it might hurt. You hear it should be magical. You hear you'll bleed. But what's actually true? If you're feeling nervous, confused, or pressured about your first time, this video is for you. Welcome to Glow and Grow, where we talk about women's health in a safe, respectful, and real way. Today we're having an honest conversation about your first sexual experience, what's normal, what's not, and what no one usually explains clearly. Let's take the fear out of it. Number 1. The truth. Everyone's experience is different first. Let's clear this up. There is no normal first time. Some women feel discomfort. Some feel very little pain. Some feel emotional. Some feel underwhelmed. And all of that is okay. Your body, your emotions, and your comfort level are unique to you. If anyone ever told you it has to hurt or has to bleed, that's not medically accurate. Number 2. Why some women feel pain. Let's talk about why discomfort can happen. There are a few common reasons. Anxiety or fear. When you're nervous, your pelvic muscles tighten. Tight muscles equals more discomfort. A lack of arousal. Your body needs time to naturally lubricate and relax. Rushing increases pain. Not enough lubrication. Even if you feel ready emotionally, your body may need extra help. A pressure or lack of consent. If you don't fully feel safe, your body reacts. Here's something important. Pain is not a requirement. It's often a sign your body isn't fully relaxed or ready. Let me ask you something. Did anyone ever teach you that your body needs time, safety, and comfort first? Probably not. And that's the problem. Number 3. The truth about bleeding and the hymen. This is one of the biggest myths. Not everyone bleeds the first time. The hymen is a thin, stretchy tissue at the vaginal opening. For many women, it has already stretched naturally from sports, tampons, or normal movement. Bleeding does not prove anything about purity or virginity. Virginity is a social concept, not a medical condition. Your worth is not defined by bleeding. Number 4. Emotional reactions no one talks about. Here's another thing no one prepares you for. You might feel emotional afterward. Some women feel closer to their partner. Some feel vulnerable. Some cry, even if it was consensual and wanted. Why? Because intimacy isn't just physical. It involves hormones like oxytocin, often called the bonding hormone. Your feelings after are valid. There's no right reaction. Pause for a moment. Have you thought about how you might feel emotionally, not just physically? That part matters just as much. Number 5. Practical tips for a safer, more comfortable first time. Now, let's talk about what actually helps. Go at your own pace. There is no deadline. Communicate clearly. Say what feels okay and what doesn't. Use lubrication. It reduces friction and discomfort. Focus on relaxation. Deep breathing helps your muscles release tension. Make sure there is real consent, not pressure, not guilt, not fear. Consent means you feel safe. You feel ready. You can say stop at any time. And here's something powerful. You are allowed to change your mind. Number 6. Protection and health matters. Let's talk health. Even your first time can result in pregnancy or sexually transmitted infections. Using protection like condoms reduces those risks. If you are not planning a pregnancy, talk to a healthcare provider about birth control options beforehand. Being prepared is not shameful. It's responsible. Number 7. When to see a doctor. Some discomfort can be normal, but you should speak to a doctor if you experience severe or sharp pain, heavy bleeding, pain that continues for days, burning, or unusual discharge afterward. These could signal infections or conditions like vaginismus, where pelvic muscles tighten involuntarily. There is treatment available. You are not broken. Number 8. Let's talk about pressure. Before we close, I need to say this. If you feel pressured by a partner, by friends, by culture, pause. Your first time should never be about proving something. Not to a partner.
not to society.
Not even to yourself. It should be about readiness, safety, and mutual respect. And if you're not ready, that's strength, not weakness. Closing message. Your body deserves patience. Your mind deserves peace. Your experience deserves safety. The first time is not a performance. It's not a test. It's not a milestone you must rush toward. It's a personal decision. And the most important voice in that decision is yours. If this video helped you feel more informed or less alone, please like this video and subscribe. At Glow and Grow, we believe in honest conversations that empower women through education. Share this with someone who might need a safe, factual explanation. Because knowledge replaces fear, and confidence starts with understanding. This is Glow and Grow, where we believe every woman deserves to glow and grow in her health and confidence.